talk about life, where we talk about love, where we talk about our journeys through grace. It's her voice and her perspectives on perspectives. 26 to 65 chats for women.
Welcome. So today we have a guest with us, Dr. Ivory. Yay. So we're missing a few today, but that's okay. We still have enough information and enough topics to talk about that we missed them, but we're moving on.
Absolutely.
So Dr. Ivory, can you just tell our audience what type of doctor you are? And just give us some gems.
Gems, I can talk to the cows come home. So I'm an obstetrician gynecologist. So technically I'm an allopathic physician.
Okay.
I'm a doctor of medicine.
Okay.
So that's what an MD is. A DO is a doctor of osteopathic medicine. And those are the two categories of physician that can be licensed to practice medicine. So I can prescribe, I can take you to the hospital, I can do surgery, I can do all of that. And primarily what that is sick care. If I give you a medicine, I know what the top 3, 4, 5 side effects are, especially ones that are going to kill you.
Right.
Because if I know that, then that's part of the decision making into whether this is good for you or not.
Right.
Okay. I know what it should be doing for you. So are there specific issues that could be going on with you that make this drug too risky for you?
Right.
I'm responsible for knowing all that. That's what I went to school for. And to not get that information, I firmly believe those are my colleagues dropping the ball. Now, if a patient comes in and they don't tell you all the details of what's going on,
history.
I'm not a mind reader.
Right.
And the notion that do I need to ask every single patient 100 questions to make sure I don't miss that that they've provided the information that I need. I know the level of information that I need.
Right.
But I need you to be truthful in what you're telling me.
Right.
Absolutely.
Sometimes patients don't understand how to communicate what's going on with it.
So I've noticed that they've changed like the forms that they give us. So now instead of having the list of all of your ailments and your family history, they now do it once a year. And actually at my dentist's office, I had to do it like 6 months after I filled it out, before. So maybe they're starting to get more in tune to, let's get this information.
Have it more up to date.
Right. More.
The technology is catching up.
Yeah, the technology.
The ability to capture more data efficiently and quickly is there.
Yeah.
And so now we're getting more data, but nobody reads it.
Right there. That's the
When's the time to read it?
Right.
If I'm going to get a book on you, I don't have more time in the day to read it.
And even when given like a medicine, are the doctors taking the time to, when they decide that a patient, can benefit from taking this particular medicine, are they taking the time to look at the records to say,
No.
See if it has adverse effects to another medication that it
yes.
No. Oh, no. I was saying that before you finished. I was like, no. Where is the time? Where is the time? But technically in the whole healthcare team, who's responsible for paying attention to that? That is a pharmacy issue.
Okay.
In a sense. That's a backup. Okay. Now,
makes sense.
I don't need to give you medicine without knowing what medicines you're on.
All right.
That is a physician role. When I'm getting ready to prescribe something, of course I'm supposed to know what you're on.
Right.
Of course it's right there in front of me. But what if you didn't bring your medication list? And you forgot? A lot of times things happen because it happens, not because it's somebody's fault or somebody intentionally did something bad. The patient is not trying to be funny. You're not trying to be loose with them. The pharmacist didn't mean to miss it, but you went to you got a mail-in pharmacy for that. And so your local pharmacy.
That's good.
So the technology is now starting to catch up, but it's still disjointed. AIs don't fix that. But then what do you do with more information?
And you know what? And you're right about the melon stuff, because I had one of my vendors from work.
Mhm.
We were just talking one day, and she says, "Girl," she says, "You know what? I'm gonna send you this website. You can get this, you can get this, you can get that, da 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 da. You can get right from the website."
Wow.
It's like,
Oh yeah.
And so do they monitor that?
no, who's monitoring?
Oh, wow.
See, there's this notion that somebody is paying attention to keep you safe. This
No.
is the Wild West again.
Mhm.
Patients can get online and talk to anybody who says that they're anything
Mhm.
and
Yeah,
get them to pay them $15
yeah.
doctor's fee
Yeah.
Mhm.
to have them write you whatever medicine you want.
So,
And how is that? That's not going to be in your medical record.
Right.
So if you
That's
come to
right.
me as your primary,
That's dangerous.
if you come to me as your primary
Yeah.
and something else is going on, and I'm making all these assumptions, you don't tell me
Right.
for fear that you're going to get fussed at, which you probably are, because that's how we are. But for fear, for
Yeah.
omission, for trying to
Right.
conceal it, whatever, you forgot any of that. And then there's a disaster. Whose fault
Yeah.
is that?
Mhm.
And who's going to get blamed? The doctor's going to get blamed. The doctor's going to get
And a lot of people are like self-diagnosing too,
because
because
of
you listen to
yourself.
that family member or friend or whoever. It's like,
That's what
have
they-
that.
Yes.
Right.
Yes.
And then they go and get the medicine, the same medicine.
Or somebody in a Facebook group or
Yeah.
somebody on Instagram
Yeah.
Right.
or whatnot. And then you come in the office to your doctor because something's not right. And
And you're not gonna, more likely, you're not gonna disclose that because you don't want to get them in trouble. You know, you're gonna have, that story's gonna have to unravel, and you're not trying to get people in trouble. So you're probably not gonna disclose that
right,
you've been taking said medicine.
right, that I'm taking this vitamin or whatnot because I don't think my doctor likes vitamins and this and that. Yeah. But now something's wrong. You're not functioning well. And yet you want your doctor to be able to figure all these things out without having all the information. Doctors are quitting left and right.
Really?
Yes,
I hear a
ma'am.
lot about that. Yeah.
And then when you get to a hospital and whatnot, you may be getting seen, but you're not getting good care. I mean, I've experienced that. I've experienced that with a family member very recently in this last month or two. And I hospitalized for 3 or 4 days and walking out the door, somebody decides to change their medicine, walking out the door to something they hadn't even taken. And then they start having side effects. So we were back in the emergency room. And in a 2-week period, 4 ER visits, 4 days in the hospital, and had no follow-up, and still wasn't better.
I'm
It
seeing
was
the trend
horrendous.
of the physician's assistants too.
Nurse practitioners, physicians,
Yeah.
because it's cheaper for the hospital to hire one doctor and require that doctor to supervise 8 mid-levels
Yeah.
who don't have the same level of
That
training.
more or less.
And so then it becomes problematic. So there are a lot of things because profit motive, like everything in the US,
Mhm.
everything
Yes.
is about profit. This is going to be controversial, but one of the best healthcare systems in the world is Cuba.
As well.
Cuba.
Wow.
You have, let's say, a neighborhood, a geographic area that a physician is responsible for. And there's
Really?
there's a healthcare team, a primary.
Yeah.
There's a healthcare team
Yeah.
with a nurse that is going out, seeing patients, seeing home visits, things like that. But that segment that you're responsible for, you're responsible for them being well, for them being for surveillance, things like that.
Mhm.
And therefore they know, individuals know who to go to, where to go
Mhm.
to get their care.
And it's right there.
What's
number one.
going on, and it's there locally and whatnot. Cuba exports doctors around the world
Wow.
because it's that level of training
Yeah.
and skill. And then the numbers are there to send more doctors. But what I loved about that notion with them was that everybody is going to be taken care of. And talking about maternal mortality and talking about Black maternal mortality. And then we talk about, I'm very much against home deliveries, 1000%. because when things go badly, they go badly quickly and they're not necessarily predictable. And time makes all the difference in the world. Less than 20% of the time will you get into trouble. You just can't predict who that's going to be. And so if we're going to have zero tolerance for mamas being dead, babies being dead, moms being injured, babies being injured, then I can't promote and get on board with home deliveries. But how many communities in this country have no labor and delivery within 2 and 3 and 4 hours? And so what are we supposed to do? What are those women supposed to do? And as the situation gets worse, more and more hospitals are closing, and these are rural hospitals.
Right.
So people outside of an urban, suburban core are increasingly not having access to a labor and delivery unit, not having access to good acute care. And let's be clear, look what happened to our community.
Yeah.
Who in our wildest dreams would have ever thought
Right.
that Woodstock would be torn down, closed and torn down?
That's crazy.
The biggest hospital in the county.
Right.
So, so now in the central area of the county, where are women going to deliver their babies? Where are Cocoa Rocklands, Port St. John women going to deliver their babies? Sharps. You know, where?
Yeah.
Vieira was nowhere. Vieira Hospital does not have the capacity. And they've got to take the beach side and Merritt Island. They've got to handle the entire Central Brevard.
That's great.
And they were always supposed to be a secondary hospital. And Woodstock is gone because at some point it got sold to a company, Stewart. And, you know, it went from Woodstock to CHS and somebody, and then Stewart. And Stewart was a physician-run company that was supposed to be, you know, physicians are going to get back into control of medicine, and they looted everything. What happens? The physician is the one that has to take the blame for it. And not trying to say, we know that in training. We learn that in training.
Right.
But it's a whole different ballgame when you face it yourself.
Yeah.
Even if you know it's going to be defendable. Even if you know odds are you're going to win the case. What is it taking out of you to go?
It takes a lot. Yeah.
You know? And so it's a lot. It's a lot. I mean, so there's so many aspects because I have seen a colleague who I wish I could have sued them. I have seen malpractice where they did the wrong thing. I have seen patients that sabotage themselves to make it look like the doctor did them in. I had a patient like that one time.
That's risky.
That's crazy.
Yeah.
She did a surgery on her, and she was picking at the incision until it got infected.
Jesus.
And then comes back in, and I'm pulling my hair out. Like, how do you have this? I'm like, and it's so funny. It's this. You go back to some of the old school stuff. When she came in the second time, and I realized I needed to admit her, I could tell by the smell of the infection. I was like, this is not a bacteria that came out of a surgical incision. It was crazy. And then I find out later, after it's all said and done, it's a big rigmarole. The nurses caught her sabotaging the incision again, even though we almost had her straight and whatnot. All of that. Then somebody let me know.
Is that like Munchausen?
Yes, it's definitely Munchausen. And so she had done that before at another hospital. And then turned around and then sued the medical team. And it was under a gag order after the settlement. And so it's not in her record. Because I would never have taken her to the operating room if I knew she had that history of that kind of behavior.
Right.
You know?
Absolutely.
And so what do? Craziness. Because she tried to sue me. And we got that taken care of. Because we were just like, look, you may have been under a gag order, I said, but there are people who were involved in your previous care who remember you. And so if we need to go back to court, first thing we're going to do is get that gag order lifted so that we can go back and show the behavior. And she disappeared.
Just
It is crazy.
disappeared.
Yeah.
That happens too.
You know, and people are human. But people forget sometimes your doctor is human.
Human too.
Right.
Right.
Like, man, I can tell you stories.
Yeah.
I can tell you guys stories.
So there is a pill or injections that are out now. The GLP-1, semaglutides, the sepetides. What is your perspective on those quick fix?
You remember Fen-Phen?
Yeah.
I remember Fen-Phen.
You remember Xenical?
Mm-hmm. That's all it is.
You remember bariatric surgery?
Mm-hmm.
So, in the U.S., it's about marketing. It's about there's a level of group hysteria that you get caught up in the hype.
Yeah.
That's definitely.
Obesity is a huge problem. It just is. What's the fix for obesity? How did we get here? Nobody's talking about how McDonald's did sugar size me.
Mm-hmm.
I know.
No, you know, like I talked, like in the talk a few weeks ago. Nobody talks about the fact that we think a dinner plate is an 11-inch or 12-inch plate.
Yeah.
That's a serving plate.
Isn't it a handful or something?
So a serving of meat
Yeah.
is inside the palm of your hand. That's 3 to 4 ounces. Okay. A serving of green leafy vegetables is a cup. A serving of other vegetables and fruit is a half a cup.
So do you think that couples, before they get married, do you think they should live together?
Yeah. I don't care. One thing I will say, and a good friend of mine told me this. Living together does not predict how people are going to act when they're married.
That's true.
No, it
Have you ever seen the movie Manchurian Candidate? The Manchurian Candidate.
Mm-mm.
Okay.
Manchurian-
The Manchurian
Oh,
Candidate.
Manchurian Candidate.
Manchurian, like the old country Manchurian.
Yeah.
The Manchurian Candidate. There are 2 versions of that movie. There's like a 1970s version. And then there's a Denzel Washington version that was a remake.
Oh.
So go look at the Denzel Washington version because because it was very well done. So the premise of the Manchurian Candidate is that the soldier got captured and got brainwashed during the captivity, and it got brainwashed in a way where there is one code that gets said. And it'll turn that programming on to turn them into a killer to assassinate somebody, just not a president or whatever.
Mm-hmm.
But they have no idea they've been programmed.
Oh, wow.
Have no idea they've been programmed. So they've gone along in life. So, you know, they get rescued, the war is over, this and that and the other. They're all going on about their lives, this and that and the other. He's, you know, a Secret Service member or something. And you know, I don't know all the details, but he's in the Secret Service and whatnot, and this and that and the other. And he's standing near the president, and he gets a phone call. And a phone call just says whatever the code word is, and then it click. He starts planning to assassinate the president, and almost was successful with it.
Wow.
I say marriage is the Manchurian Candidate, and the code word is "I do."
Mm.
And once you turn on, once you turn on the programming,
Yeah.
and then all of a sudden, you start behaving like you think a wife is supposed to behave. And you start expecting your husband behave like you think a husband should behave.
Right.
That may not be who you are or who you were when y'all were living
So
together
it's a
and dating,
false.
because there's a programming.
Yeah.
We have this programming about what marriage is,
Right.
what you're supposed to do, what you're supposed to do as a wife, what you're supposed to do as a husband.
Right.
And you start acting like you think a wife should act, or feeling guilty that you're not living up to being the wife you're supposed to be.
Right.
It's programmed.
Wow.
So how do you unload? Because you know the worst part of marriage is that first year. The hardest part is that first year.
It is.
Because that's who you
Absolutely.
find out
Right.
who you marry.
Yeah.
And they find out who they marry.
Right.
And our behaviors change after we say I do.
Right.
At least the first time.
Do you think before marriage, you should sign a prenup.
Yes, if you have something.
Macy, what do you think?
But now, if you have nothing,
Then you have nothing to lose.
you have nothing to lose. So, like, I wouldn't tell 19-year-olds to be signing a prenup. But
Right.
if you, what is Travis Hunter
Oh yeah,
in Jacksonville?
yeah.
He signed a he had her sign a
Did
prenup.
he?
Or no,
I don't think
no,
so.
they were mad because he didn't have her sign a prenup.
Right.
Well, he's a fool. He has well, he has everything to lose.
He does.
Right.
So at
He
this
has
stage,
them.
so at this stage of the game, if me and my
At
main
this
woman,
stage of the game, that's
Well,
this volume.
at this
Right.
stage of the game, if me and my one get together, find each other before we die, I have a child, he's probably going to have children, and so it would be irresponsible of us
Right.
to not address what we already have,
Right.
and it would make sense that everything that you're bringing to the table be put in a trust, be put in a manner where it is protected for our children's inheritance separately,
Right.
because before we got together, that's what was happening.
Right. Right.
Having a clear understanding of what we're going to do together
Together.
moving forward,
Right.
and how do we want to manage that when one of us is gone,
I think that's fair.
Right.
you know?
I
So,
think that's fair.
yeah,
So,
so
do you think he should get anything from you, or no?
what do you mean?
Or should it just go to the kids?
Well, I think
For the things that I'm coming in with
Yeah.
and the things that he's coming in with,
Right.
that stuff should go to his kids. My stuff
I
should go to
see.
my kid.
I see. Okay.
The things that we're doing together moving forward,
Yeah.
we put in provisions that if one of us dies, the other one
Right.
has all the rights
Right.
to the house
Right.
to live there forever.
Yeah.
Blah 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 blah.
because
Yeah.
the
And
other
then when
things
the-
are already taken care
Yeah.
of.
Right.
You know, and so going forward and what we accumulate and build going forward, how are we going to handle that jointly?
Yeah.
And that's a whole different ballgame. Do we want to do something completely separate? Do
Right.
we want to split it down the middle?
Yeah.
You know, with our kids, or do we want to leave it to grandkids? Do we want to put it in a
Yeah.
trust for future generations? I mean, we'll
Yeah.
have that discussion because we're doing that together.
Right.
But it makes it far more clean
Mm-hmm.
and clear
Yeah.
from the get-go. What if we both have houses coming
Right.
together?
Right.
Absolutely.
And
And
so-
what if you guys together decide, okay, you sell your house. Okay, so who gets those proceeds?
Right.
No, I do. Me. Are
Right.
you selling my house? But having that discussion,
Right. Right.
if,
Mm-hmm.
you know, am I going to sell my house? Maybe I'm not going to sell my house. Put it in a trust, put it
Yeah.
in for rent.
Right.
All the money that trust,
Right.
the beneficiary of that trust
Mm-hmm.
is my child,
Right.
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 or, you know, whoever
Mhm.
that is under my control.
Right.
And there is that.
That's-
You know, I mean, it's so easy to make clear distinctions from the get-go
Yeah.
before behaviors and
Yeah,
personalities
Absolutely.
and the
Yep.
additional
Mary J.
interest, the additional interests of your children,
Right.
potential grandchildren, children coming back to live in the house.
Yeah.
You know,
Mhm.
do you
good.
say they can't have that? I don't know.
Right.
You know,
Yeah.
I don't
But I
know.
mean, that's
But
the
you have it up front.
great
Yeah.
discussion.
As long as it's-
Yeah.
Make
And
clear.
you at that point get to that point, and it's like a lot of times that's when you find out who you're really with.
That's what I'm
Right.
talking about. Because when you do the
Oh,
prenup,
speaking of finding out who you're really with, do you think when you come into a relationship, you're privy to all of the information from your partner's past?
I don't think. I mean, initially not. It depends on how the conversation goes.
What, so,
does your body count?
so
Yeah, it depends on. It depends on.
I'm a gynecologist. I can rise straightforward.
No,
You
I love it.
You gonna confess your body count?
It really. Well,
look,
no.
well,
I think, but you know what? But wait, it depends on how the conversation is going, right?
Do you want to know his body count?
And so
Do you want to know if he's ever
Absolutely.
been with another
No.
man or
You can also, oh, and you know what? And you can also,
I think when it get.
Please.
we did this. The booty man. We just.
See this. Okay, I think. Okay,
she said, "What's your body count?"
I'm put that out there.
Yeah.
But I think it depends on how the conversation is going, because if the conversation is going very well, okay, so one conversation, okay, it warrants the next conversation, okay, and then you begin to determine, it's going well, okay. If both people, especially rather when both people are understanding, okay, that we both want the same thing. This is dating to marry.
Right.
So you got to be very, very specific.
Right.
This is not court. We didn't even court back in the day. Okay. Just gonna put it up. We did court back in the day. Okay. But being like-minded and understanding with dating to marry. So you're you're raw. Okay. With all of your questions, the whole 9 yards. Okay. So as you're getting to that, okay.
But what are your questions?
Right. Okay.
Questions. Okay. So my questions are wrong. My questions are wrong too. Right. So you asking that? I'm like, yes.
Right, but what? Because ultimately that's what you're asking.
Yeah.
What are the questions?
Yeah.
Are there questions that you are not going to ask?
Right.
Because I have found that they tend to get offended.
You know what? But you know what? You have to
If
be
you're
specific
offended,
because one of the main questions that I ask is, have you ever been incarcerated? And if so, how long were you incarcerated?
Well, we incarcerated folks.
Right. And have you, has a man ever touched you? I want to know all that information.
Have you had relations?
Right.
Same sex?
Yes, exactly.
Okay. Yes. Whether they've been incarcerated or not.
Right.
So what are you going to ask? If they're not incarcerated, are you going to ask that question?
Yeah.
Yeah. So it becomes, what are the questions you're going to ask?
Right.
Nowadays,
I don't need to know body count.
Okay.
You can know too much.
Right.
You
Okay.
can know too much. I will be judgmental if the number's too high.
Right.
I'm not. I just can't help that.
Okay.
So
Right.
I don't need to know the body count, and I'm not going to ask it. I'm going to ask if any of those bodies were same sex.
Right.
Okay.
Absolutely.
Mm-hmm.
I'm going
That's
to
a good
ask, were any of those bodies unwilling? Did you force yourself around any of them?
Right.
I'm going to ask what kind of things they've done.
Right.
Okay.
What got put where?
Oh dear.
Mm-hmm.
I don't know.
Okay, I'm gonna but I'm gonna call that.
Right. So her friend was
taking notes.
is different.
Yeah, my brain was
There's a way that you can ask.
Yeah, no hold on.
Right.
Because people will twist
Absolutely.
around. Okay, Bill Clinton's a perfect example. Bill Clinton.
Oh, he said he had no
I did not have sexual relations with that woman.
Right.
Because his definition of sexual relations was a penis going in a vagina. And the fact that she was all freaky deaky all over his penis wasn't sexual intercourse with him.
Right.
Because he's FOS. We know that.
Right.
But technically,
Right.
the definition of sexual relations for him was not met. And you asked a question.
Right.
What number one thing one of my old professors taught me? People will answer the question that you ask.
That's it.
So ask the question. Make sure you're asking the question.
Even lawyers say
They
that.
want the information from you. Yeah.
Don't
Right.
too much.
Right.
Hey, I'm
Answer
sorry,
the
what
question.
brought you in today? The glass? I'm like, happened a million times.
Wow.
I mean,
Great example.
but that is the perfect example.
Yeah.
Because they answered the question.
Right.
Then I asked them.
That's
Right.
it. Yeah.
Right.
Yeah.
Yeah.
Straight up.
Wow.
I don't ask people if they're homosexual, transsexual.
You ask the right questions.
Have you had your penis or somebody's penis in your body or in somebody else, some other man's body?
Right.
And I agree. I agree because one of the main things I say all the time is 25 anymore.
I know. I have no time. I'm at
I have no
8
time to wait. No holds barred. You can't handle a few rock questions. You're not there.
Right. If we
Right.
can't have an open discussion,
Right.
an open discussion.
We all have a journey that has ensued. Everyone has a journey
Right.
that they're on.
Right.
Past, behind them. No holds barred.
I'm not going to ask, have you had an STD? Because somebody may decide something is an STD and something isn't.
That's good.
Have you ever been treated for gonorrhea? Have you ever been treated for
Have you-
chlamydia? Have you
have you
ever
been
had
treated?
herpes? Have you ever?
This is good.
Yeah.
Yeah.
You know, but and more important, and I'll be honest, I don't really ask about gonorrhea, chlamydia because those are treatable.
Right. I was just curious.
It's like, do you have herpes?
Mhm.
Do you have
Extra one or
warts?
two.
I don't even care. And do you have herpes? Do you have HIV? Because now you tested as negative. Do you have herpes? Do you have HIV?
Right.
Wow.
Do you have warts?
Is that crazy that you have to just really?
Yes, you have to.
No.
Look, there is no romance.
Better ask.
There is no pretense. There is no cuteness. If you knew the amount of STDs, like it's spring, it's chlamydia season.
Jeez.
It's chlamydia season. It just is. It's getting warm. The kids, the teenagers are running wild.
Yeah.
Yeah.
They run into the beach. They're running wild. They're having sex all over the place. They're mutually monogamous. They may have had 8 partners this year, but they ain't have them all at the same time. They're back to back to back to back to back. So they say they're monogamous.
Mhm.
Wow.
But it's, but they're monogamous for 6 weeks and then they're on to the next partner. So this is a time of year where the office will be hit with chlamydia, nuances chlamydia, nuances herpes, across the board. Across the board. The chlamydia season.
Wow.
And people get mad when I say that. I'm just like, so it's like y'all want to pretend that the world is so and so and it's so pretty and so beautiful and so perfect and it's not, and it's not. And it's okay. That's the thing. It's okay to be clear on the reality.
Right.
But we want to live in fantasy land.
Yeah.
And I don't like living in fantasy land. And I can't, I don't function like that. I need reality.
Reality.
I can deal with reality.
Yeah.
Yeah. Because I don't like to be fooled. I don't like to step on the ground and it gives way. If it looks like the ground is solid,
foundation.
Right.
I expect it to be solid when I step on it. It shouldn't give way. And that's how I feel when people put on an appearance of things, put on the proprietary notion of what it should be, as opposed to how it really is.
Right.
Because you can
Facade.
get so much closer to greatness
Right.
through the path of truth.
Mm-hmm.
It's true. And I tell my child all the time, the truth doesn't change.
Right. My professor said that you cannot refute truth.
Yeah. Because it doesn't change.
Right. Oh my goodness. Okay.
She's scared to ask it.
Ooh, I'm scared.
She's scared to ask it. She thought you were wide open.
All right. So, true or false? You should marry a man that can fix things and pay bills.
True.
True.
True or false? Never move in with your spouse's parents.
False.
Depends on the circumstances.
Okay. Why do you say false?
Because you don't know what the situation is. I may be the daughter my mother-in-law never had.
I know. True.
It could be fabulous. I don't know that. So I'm not gonna
never.
handicap myself and say never. So that's why I say false. Never say never. You don't know what the situation is.
Okay.
I tell my son all the time, I'm waiting for you to bring me the daughter I never had.
Right.
Mm.
Yeah.
That's good.
And as soon as we all get along, I'm gonna treat her like a princess.
Right.
That's good.
So
Yeah. That's how Vicky's parents treated me.
yeah.
Yeah. All right. True or false? Save your money and don't tell him about it because he'll want to spend it.
Save your money.
Save your money. Like, say you guys are putting it in the household, but then you also have your own stash. You're saving your money. We don't tell them about it. True or false?
I'm gonna say false. I probably thought differently at 25. Okay. But at this juncture, total transparency
Mm-hmm.
and where we are, if I do that, there's gonna be agreement and an understanding that I'm putting
Right.
setting money away. Yeah. I don't
Okay.
want to I refuse to live with someone that we're not there together.
Right.
Right.
I
I
can't
love that.
I'm not
Yeah.
I'm not doing it.
That's
Nah.
that's my answer too.
Okay.
The traditional answer is always have mad money,
Right.
but
Yeah.
that is because of the circumstances. Women with children did get hired.
Right.
Okay.
Yeah.
If you had a child, you need to be home taking care of your child. And this is a majority culture, but for the most part, women didn't have a lot of choices in terms of jobs.
Yeah.
There was no daycare.
No.
You see what I'm saying?
Right.
So
Mhm.
there was no alimony.
Right.
And, I don't magically know all these things. I had a patient clue me in. Patients over the years clued me into some of these things.
Mhm.
And
Yeah.
one particular patient, when I was getting divorced, and I was asking, I had an old lady, and she's like late the 80s, had been married forever. And boy, I mean, we went through lunch talking,
Okay.
and she was like, you didn't
Schooling
quit
you.
because she was like, you didn't quit your husband because you can't get a job if people know you have children. There's no daycare. I don't have an education. I didn't go to college. I got married and
Right.
started having babies.
Right.
I couldn't feed my
So it's a
children.
different
There was
circumstance.
no alimony.
Right.
Mhm.
You had to have a reason to get divorced. And the judge may not agree that him being unfaithful is a reason for you to get divorced. She said, the world that I lived in is not the world your girls live in.
Right.
And I was like, that was an eye opener for me.
Yeah.
Wow.
That was an eye opener. So the traditional notion, you always keep mad money. We were raised like that.
Yeah.
But in this, I'm with Denise 100%. We're not living a traditional life. We are on the table. You're my partner. We're in this
Right.
together. You're not some crazy person. I'm not some crazy person. If we're putting money aside, then we're putting money aside. It's perfectly okay
Right.
for us to have a joint account. Your money is your money. My money is my
Right.
money.
Okay.
We're going to put an X amount in an account
Right.
for our joint expense.
Right.
However we decide to
Right.
do it.
Right.
But it's on the table. There's no under the table, on the
Right.
sneak and do this,
Right.
any other
Exactly.
kind of stuff.
Right.
And having those walls,
Mhm.
let's say he does
That-
go
that
crazy and
yes.
starts running up credit cards and things like that.
Mhm.
Your credit card, my credit card is my credit card. But my stuff is walled off. Your stuff should be
Mhm.
walled off from any excess or craziness that can come up. And then we're all in a better space in it.
Absolutely.
Right.
So
Okay. Okay. True or false? Don't make him your whole world.
true. That goes back into the boys' night out or whatnot.
Mhm.
That's a heavy load to put on somebody. She's gonna be my everything. And
It is.
3 months down the road, 3 years down the road, I may like something different. So you got to change it. That's a heavy load.
Yeah, that's
Yeah.
an expectation that shouldn't be there.
Yeah.
Okay.
Yeah. If it works out that way
Yeah.
and we join at the hip and whatnot, then it is what it is. But I don't
Just
necessarily
because we
seek
both
that.
want it that way.
Yeah, I don't seek it,
Right.
but I'm old enough and mature enough now.
Exactly.
That doesn't scare me.
Yes. Yes.
Because that just means I found the one.
Right. Ooh,
That's
I
exactly
wish he would
what it
come on.
means. That's exactly
Yeah.
what it means.
Yep. I wish he would come on.
Yeah, I hear you.
All right.
You and me
let's
both.
see. Oh,
Makes three of us.
husband or boyfriend has a best friend that is of the opposite sex, female, but you and the female are not friends.
Ours are not friends because we haven't met, or not friends because
He doesn't put
our
her.
person, we got a personality conflict.
So regardless.
Right.
Well, right.
It really don't matter. Right. Because if she's not in,
You're right. It
Right.
doesn't matter.
like as a couple, that's a problem. And so he's got to choose the relationship,
Right.
the friendship.
Ooh. Yeah, I went through that. She had to go.
Yeah.
You know.
I mean, because if they were friends, even long before
Right.
us,
Yeah.
okay,
Which,
and
yeah.
if it's understandable how you feel about her, you guys are down or whatever, but now, it's us.
Yeah.
And if she can't understand that, that should tell you something about her. Sorry. Because if she has your best interest and you're telling her that she was, we're an item, if she has an issue, she needs to go deal with her issue.
And if I've got two male friends that are married, and I'm not going to put them in a position where their marriage is threatened by our friendship, because the marriage is primary.
Right.
And it doesn't matter. We've been friends for 40 years or whatnot. I don't want to. One friend's been married a couple times. One of the ex-wives was not a good match, but I still have to respect his decision making.
Right. Yeah.
And still,
Yeah.
we're friends. And when it went south and north and left and right and
Mhm.
blew up,
Right.
there wasn't an "I told you so." It was just that we're still
Right.
friends. And he's remarried, and I love his new wife. Are she and I besties? No, but we don't. There's no problem.
But there's a mutual respect.
Absolutely.
Yeah. Yeah.
I always ask about her. She asks about me when we're around. They don't live here. When we're around, we're all hanging out and this and that. And she's a wonderful person. And so, a true friend, all of
That's
that
it.
comes with the package,
That's it.
and it fits in
Absolutely.
seamlessly.
Right.
Seamless.
And that's where the transparency comes around again. Because me and him text all the time, and this and that, and the other, and this and that. I don't think for 1 second she has any thought that there's anything going on, anything wrong with that.
Mhm.
I'll call him if I need some help or advice with something. He will call me. I'll ask about her.
Right.
He's called me about stuff with her.
Yeah.
To get help. No
Right.
problem, no issue.
Right.
It's the transparency.
Absolutely.
That was the
Yeah.
best word, Denise. That is all out in the open. Ain't no tricks,
Right.
no drama.
Right.
Life
Maturity.
is hard enough. It's maturity. Yeah.
It is
Yeah.
maturity.
You didn't want to jeopardize,
No.
your friend's
Right.
marriage.
No. I haven't helped my friend to jeopardize his marriage, and he's got a good marriage.
Right.
You
Absolutely.
know,
Mhm.
Absolutely.
even if you had a bad marriage, I've said my piece,
Right.
and it is what it is. And so I'm not going to keep beating you over the head
Mhm.
with it. You got to live with it.
Yeah.
And it is what it is. But
Mhm.
it's being grown people
Absolutely.
moving forward in life, wanting the best across the board, wanting no drama. I stand drama.
Me either.
How did I
Me
go
either.
into OBGYN? I do not know, but I cannot stand drama. You hear me?
Right.
Mhm.
Get peeved.
Yeah, absolutely. Just so unnecessary.
Yes.
Yeah.
All right. So we're gonna do just a little game. It's called keep or drop.
Keep or drop.
Okay.
I'm loving this.
Okay, and this is about relationship. These may be signs that he's not too serious about you. All right, keep or
Okay.
drop. Everything with him is last minute.
Drop.
Okay, what do you mean by that?
A little more detail.
Yeah, that is
Not be a keeper.
So
yeah, that's
so
so. I guess it's potentially a keeper because that doesn't sound bothersome to me.
okay. So him being last minute with everything is not bothersome to you.
Just on the surface of that statement, no.
Uh-huh.
No.
Okay.
Now, what does that mean? I would need
Flies almost like flies by the seat of their pants.
That's not gonna bother me
Because
because I can do that.
Okay.
I'm less regimented. I would be far more bothered by this is how she needs
Oh,
to
it's
be.
just
Just
like
like
this.
this. Yeah, no,
Okay.
that would be more bothersome
Okay.
to me.
Yeah.
Like
Yeah.
Than let's go.
Right. Okay.
I'm
Okay.
far more free spirited
Okay. That's
than regimented. So
So
that's
you're
probably-
you're drop, you're keep.
Okay. Well, I have to give you some more detail. I mean,
But it's okay.
I'm gonna change it and say I mean, because
You can
change him. You can change him.
yeah. Well, no. I don't plan.
You don't plan
I
on
was changing nobody.
Oh no.
I thought that at 20. No, I don't know if I can change about it. Just give us some ground set. Even as it's just kind of like Donna said, being attentive to the things that's okay. It's that worth it
Because that
worth
would
it.
be flexible. Yeah.
Right.
Okay.
And we have to be flexible, and you have to give people grace.
Okay. All right. So
Are you
keep it
spontaneous?
Hmm?
Are you a spontaneous person?
Yes.
Okay.
Yes. No.
Yes, I am. Thank you,
That she's not.
Yes, I am. Yeah. What do you mean I'm not spontaneous? Why do you say that?
We were supposed to go to Bayou Classic. We were supposed to go on a cruise. We were supposed to go to no.
That's not spontaneous. Well, I guess it is spontaneous.
Like I said,
you just said you're going to cruise next month.
So anyway,
it's spontaneous.
she no flexible.
I just said
Okay.
Yeah, I think you middle of the road, Denise.
Keep or drop. His terms only. His schedule runs the relationship.
No.
His
Drop.
schedule.
His terms only. His schedule runs the relationship. Keep or drop.
Drop.
Drop. Okay. Keep or drop. He avoids labels.
Avoids labels. A little bit more detail.
Boyfriend. We're going steady.
No, that's sketchy. Drop.
So you mean he doesn't want to say,
That's my girlfriend. That's
who would do that?
Plenty. You folks do that.
okay. 2 drops.
Yes.
Me
that's a
too.
good
I'm a
one.
drop.
Drop.
Because that doesn't make it, that sounds sketchy. That doesn't make
It
any
does.
sense. That's not transparent.
Yeah.
Now, does that
It's not
mean that,
easy.
hey, this my man. Right. This my boyfriend.
It's what
No. Do you need to project everything to the world? No. But the notion that if we're introducing somebody or somebody's like, oh, that's Donna and her boyfriend. Oh, no, we got I don't want nobody to call me your boyfriend.
Right.
Look, ninja. Oh, now.
Drop.
You weren't saying that last night.
Exactly. What was that last night? Oh, so you just
Right.
okay.
Yeah, that's tricks.
Okay. Drop. Keep or drop. You have not met anyone in their life that is important to them.
Drop.
Drop. Okay.
That's a flag.
Mm-hmm.
Keep or drop. He has inconsistent communication.
Drop. Drop.
Okay. Keep or drop. He keeps his options open.
Detail. A little bit more detail.
So you guys are seeing each other, but you're not exclusive.
Transparency. If we have not said that we're in a mutually monogamous relationship, then we're not in a mutually monogamous relationship. Now, he would also know that I don't share.
Okay.
That's
Yes.
on him.
Yes.
So when
Yes.
you're ready, so you're not ready to make a mutually monogamous commitment, I get that.
Right.
I do
Right.
not share.
Right.
You will have hell to pay if I have to go to a gynecologist and get
Mhm.
checked out.
Mhm.
Because I'm just not going to get shamed like that.
Right.
You're not going to, I never had an STD. I'm not going to have one.
Right.
So if you don't want to still be with me,
Right.
even if you go be with somebody else, just don't come back to me.
Right.
We don't have an agreement
Right.
and it's okay.
That's good.
But I need cleanliness. I need non-infected,
Mhm.
transparent,
Mm-hmm.
mature, open, communicating man.
Yes.
That's what I need.
1,000% agree.
I'm so much nicer under those circumstances. But if I got to go check in and smell,
Right.
because I'm not going to do that. I got
Yeah.
better things to do with my life.
Yeah.
Put on the table what
Yeah,
we're going
right.
to do.
Right.
And
right.
if you're not ready to make a mutual monogamous commitment, then let's move on.
Yeah.
It's okay. Let me know when you're ready. and then we can both go get tested up, and you bring me your results, and I bring you my results, and then we can talk.
Absolutely.
All right, last one. Keep or drop. He is big on words, but little on action.
No, drop.
Drop. Okay. Yeah. And you know it, if you're with a person and they make you feel more anxious than secure, then you know.
Mm-hmm.
Yeah.
Yeah. And all those things are okay. It's fine if we aren't gonna be on the same page. Yeah. No big deal. Like my biggest thing with my starter marriage, as I call it, I painted a couple of red flags white, and it is what it is.
Right.
But when I thought I was in a wonderful, happy marriage, I liked that. I want that again. I want it to be real this time.
Right.
And I want it to be lasting.
Right.
I want it to be everlasting.
Right.
And don't you feel as though you're better equipped?
Oh,
Yeah, go in
yeah.
there.
And that's why I'm excited about it this time.
Yes.
That's number 3. That's why I'm excited.
Amen. Lord, I got an honor to be married 5 times.
Really?
Mm-hmm. She's like, let's keep doing it until you get right. Oh, you ain't,
I
you
love
said
that.
I didn't start saying not putting this all right.
Right.
Move on.
Yes. Yeah. Don't stay stuck.
And,
Yeah.
and the man of her dreams, she's not even married to. She's number 6, she's not even married to.
Yeah.
Yeah, but he's the one.
Wow.
I mean, she's in her 80s. I mean,
Wow.
He's the one.
Wow.
Yeah.
If at first you don't succeed,
Try. Fine marriages. I don't need to marry you to figure out if you're gonna be good or not. I need to be knowing going in. I don't want all that drama. And I don't know that marriage is so necessary for them that the children aren't involved. I get the benefit of marriage for the children are involved.
Oh, that sounds like Oprah and Stedman.
Yeah, I got an Oprah and Stedman.
Are they still together?
Yeah.
They are.
I'm a man of Oprah and Stedman.
Oh, and then another one is Kayla she's a younger girl. She's been with this guy like 14 years. Okay, Pratt.
She's young. Oh, is that?
She's an
That
actress.
name sound familiar.
Wait a minute.
What show was she on?
The Proud Family. The Proud Family.
Who is her man? Oh,
It's
And she
What's
was
that name?
on.
It's like I could see
I
her
think I know who
face.
you're talking about.
You
I think
remember
it's like I
that
could see-
show? Shanice's husband.
Yes. I was gonna say we were just talking about that. I forget the name of that sitcom.
Yeah,
And she played his daughter.
daughter.
I can't think.
Yeah, but
I'm sure when I look her up, I'll realize who it is.
yeah.
Yeah.
I don't. They have a relationship that's
Right.
working for them.
right.
That's all that counts. Those are only 2 people it has to work for. It don't have to work for me. I may not be willing to do anything that they do for their relationship, but it's working for them.
Right.
The relationship that's working for me is mine. It's between me and him. And nobody else. And nobody else. It's gonna work for us. Not even our children. It's gonna work for us.
Right. Yeah.
And that's
mean-
what counts.
I want to be married. I think that now that I'm at the age that I am, we're in our third. Aren't we in our third quarter? We're in our third
We're
quarter.
in the third quarter, yep.
Yeah.
Mhm.
And I still believe that I don't know, love is out there somewhere, and
Absolutely.
that
As long as you believe it.
yeah, and I want
How long you been divorced?
since 2014.
Mhm. How long you been divorced?
I think I'm going on year 5. This year be 5 years. Yeah, 5 or 6.
And mine was final in 2015. So I want to be having good sex.
Come on, come on.
So minimum I want a great lover.
Looking
But
forward
if
to
I
a man.
but if I had my choice,
Yeah.
I would be married to the man of my dreams, and we have a great sexual relationship. We have a great personal relationship,
Yes.
and we're moving forward in life together.
Mhm.
That is definitely my
Yes.
preference.
Mhm.
Right.
But I don't want, it's not more important to be married than to have a great relationship.
Right.
You know, being married is not the goal. It's the relationship. And I certainly hope the relationship is the whole big deal. That's what I
That's
want.
good, because that's what you're gonna be in.
Yes. Yes.
How important are looks?
I think it's personal.
Yes. Yes. Because as long as I don't think you're a creature, it should be fine.
Yeah, right.
You know? And yet it's funny. There are things that really turn you off,
Mhm.
Right.
and then there are things that aren't.
Mhm.
I don't like short men.
Right.
Like on a real, it's bothersome to me.
Right.
You know,
Right.
I ain't mad at them.
And
Right,
that's
because
just
I have some
and it's
friends.
just your
their
bothered
husbands
thing.
are-
Yes.
You don't pass judgment. It's just your
Yes.
bothered thing.
Yes.
And I think we don't have those.
That is a thing
Yeah.
to me, for me. That
Yeah.
that would be something to overcome. But
You can overcome to the point of marrying a short guy.
if he's everything else,
Yeah.
yeah.
I don't think I go.
But now,
I don't think I go around that.
But now, could he be 5'2"? I don't know. But I don't know. I don't know, but never say never.
What?
Okay,
What
you're not supposed to.
you?
Not 5'4.5".
Oh, you
Uh-huh.
she added that four. That,
Yeah.
oh,
Yeah.
three. Yeah.
And I prefer men 5'10" or taller, but my
Right.
ex-husband isn't that tall. My ex-husband was like 5'8", 5'9". He said he was 5'9".
Okay.
Um, my daddy was 5'7", so it ain't like
Oh wow.
Right.
okay. So
6'2".
no, my dad was 5'7",
Yeah.
but my mom's family, the men are tall. So the
Okay.
majority of men in my life were always tall.
Yeah.
But I just have a taller aesthetic.
So it's your. So you have a type.
Oh, we all have a type.
Yeah.
Oh, we
So
all
I'm
have a
writing
type.
this book called "Not My Type"
Mhm.
because it seems like all the ones that I like that I feel are my type,
Mhm.
They're not finding out. They're not
they
your
know
type.
work for me.
So you're finding out they're not your type.
They know my type.
So are you still trying to discover your type? Or have you honed in on what your type is?
I think so. My type is tall. I like the light skin.
Light skin girls. There we go.
I do. I like maybe because I'm dark skinned. Maybe I don't know.
You got
But if I look back at
I like them tall, black, and fine.
black and black.
black, like dark skin, dark skin.
Yeah, but
Oh, she-
none of us can trust ourselves in terms of are we dark, are we light, are
Right.
we this, are we
Right,
that?
right.
That kind
Yeah.
of stuff.
Yeah.
This is dark. He can be this black. Then I bottom.
Yeah.
I'm not. I'm
Right.
not.
Color struck.
I'm not gonna say that because I think we all are. My
Yeah.
preference is not light skin, not especially not real light skin.
Yeah.
But at the end of the day, skin tone
Mm-hmm.
isn't a deal breaker for me.
Okay.
That's good.
Really 5'6" and below is all really kind of a deal breaker for me.
Okay.
And there are not a whole lot of other things.
Okay.
I like a heavy man, not a fat man necessarily, but I like.
Me too.
Yeah, I like a
like
bear.
that.
I like a bear of a man.
Right.
Yeah. So if I had a type, it would be a linebacker.
Yeah. Yeah, I like that too.
Yeah.
But you know what? Now that I'm getting older, I give me his heart.
I love that,
Give
but
me
it's
that
hard to be the body.
conversation.
It got to be taller than 5'6".
What?
The package.
And you can't be half bone.
Half ball, you gotta have it all off or all on.
All off or all on.
okay.
Don't teeter the fence
Okay,
with
that's
your
not
head.
a seating thing going on.
No.
like George Jefferson.
Yeah, no. I might even take you 5'5", as long as you either all bald or full head of hair. I mean, so when we start talking about the stuff that gets next to you,
Yeah.
that is far, because I'm just like, figure it out. That transition is not working for me. You gotta figure this out. Get to the end. I dye my hair because my hair is not white enough yet. I've got enough gray that it is gray, but I don't like that salt and pepper. I don't like that transition.
Yeah, yeah.
You know, I will take them heavier. I do not like skin and bone.
I don't want skin and bones either.
But you know what?
But you know,
Puny.
yeah.
That's what they used to say back in the day, puny.
I don't know. So this one guy, him skinny.
Hmm?
You know that nursery rhyme Jack Spratt.
Yeah.
That's why I couldn't give you so betwixt and both you city. Yes.
Yes.
The heart is the hour of just take
And
it.
you just
Yeah.
can you overcome that?
Yeah.
Can you
I think I
overcome
can
that?
overcome.
Yeah.
So while I am trying to get smaller, I just need him to get a little bigger.
But you know, at our age, a man that's skinny ain't gonna get bigger.
No,
He's
not.
already past the point where he's
not.
gonna get bigger. If he's gonna get bigger, if he's gonna be skinny, he's gonna be skinny. So that's not a deal breaker. That's just a preference for me. Yeah, I'm telling you.
That I
With all that head.
Which is,
Okay. That's really too.
that's a funny.
I mean, and
but
it's,
that's a good
it's
example.
something you can do something about.
Right.
And I think that's part of
put
it.
it off. Just
Yeah.
So would you? Okay, so would you, if because it's gonna be total transparency.
Mm-hmm.
So having gotten to this amazing point, and it's like, I guess you wouldn't have gotten too far, but having gotten to a certain point, it's like, would you consider going one way or the other?
What telling him he needs to do?
Well, not me, just asking him what he
Mhm.
considered.
We wouldn't have gone that far yet. It is,
See, I
mean,
said that.
yeah. I mean, it would.
What you got
We would
going
have had
on?
some discussions
Right.
long before that.
Okay.
And I would have had to make some decisions
So-
already because
so-
I don't want to get all caught up.
Right. So if he's signaling the total package is like everything except that,
Yeah, I'm not gonna.
would you be willing
Yeah.
to say something? To
No, I would.
consider?
No,
Oh no.
no, because it really does get into that notion of you're trying to change somebody.
Right.
If he is like, look, this all the hair I got, and I'm keeping it.
Okay. Okay.
All right, bet.
And it's like I said, at that point it could go either way. They could feel like
Oh
you're
my
trying
God.
to change them or
But you know,
yeah.
you know, I was like, you really don't want me to be able to get this.
You ever consider cutting all that off?
And I probably would mess with, and don't get me wrong, I'm sure I would mess with him all the time. Just like,
What's going?
What you got
But now,
now?
no comb over. That ain't, he ain't
my
going
God.
past no comb over. Don't be starting your hair from here and it's got a full hair.
I have
No.
cleaned that.
No.
know.
Or
Wow.
we in blow. No.
Go around.
A toupee. You can't do
Oh,
that.
oh,
I do wigs. I'll do wigs a week. Okay. So no, I don't do.
So you
that
don't,
great.
I don't know men are starting to do that.
They get their hair girls. They do all of that
They do
stuff.
all in.
Yeah.
Okay, so this is good.
I did it
Okay.
one time. He took his girl off. I was like,
No way.
I was done.
Nobody wears those except.
I was done.
So the wait, so here's the now that's interesting. Okay, so this is preference, right? So Dallas got like the hair thing. That's like the deal breaker for her, right? And so it made me think about this.
Confessions. Come on. True confession.
We listened and then we all okay, so here's fine. I made a mistake of saying this at work, and it's like I'll never live it down. Would you be able to date a man that took his teeth out every day?
See,
Oh my God.
if they good teeth, yeah, I'll be fine.
See, okay, so wait. So
As long as he doesn't do it in front of me. Hey, just don't ever do it in front of me.
so wait, I think of course I don't know, but it's like just I had that thought one day as I was just really just thinking about, you know, it's like I want to do this, just getting those thoughts right. And I'm because you kind of gotta know you have in mind your preferences, your type, so forth. Then it's like, wonder what did I? What if he took his teeth out?
See that?
I think that would bother me.
Hold on, baby. When I take my teeth out and put them in the put them in, I gotta clean my teeth.
I don't think I could deal with that.
As long as he didn't do it around me. I'm okay.
But they don't come to the head with no teeth in its mouth. Oh my God.
Yeah.
Denise, I never thought that. I have never.
Y'all having a y'all have some real talk. What's wrong with you? Why are you talking like that? You don't feel good?
No, baby, I need to know.
That go with the toupee and the internal thing.
See, my thing about the teeth, right? Okay, so my thing about the teeth, because in this day and age, you know they have teeth that you don't have to find overnight.
Oh yeah, what are they called?
What are those?
I mean, you
Yeah.
can get implants. You can, I mean, you know, he can get permanently affixed teeth, so he don't have to take them out every night.
Right.
You know, now I would be waiting on that. I would let the hair go, but I'm like,
You let the hair go?
I mean, you know, on the scale of things,
Mm-hmm.
I probably wouldn't, you know, depending on finances and stuff, of course, but I probably would not be okay with old-fashioned dentures because I'm like, it's, you know,
Yeah,
the technology has advanced so nicely.
So
Go
would
get
you,
teeth.
okay, yeah. So would you be willing to, if everything is there, just like, accept that? Would you have that conversation that suggests? Have you ever, you know, because maybe he's never considered.
Oh, we would have a conversation.
Okay.
This is the first time I recognize. I'm like, do you take those out every night?
That would be my question.
Yeah,
See, that's one of my questions. Are those your real teeth? Tasha, think that's
my God.
I wouldn't say it like that. I would, you know, because we're talking specifically about dentures.
Mm-hmm.
People have veneers. People have all kinds of stuff.
Specifically the ones you got to take out. Are you
Right.
taking, I'm like, wait, along with Donna's questions. Are you taking anything out of your mouth every night?
That was not on my list of speed dating questions.
Put it on there.
But it might go on there now. Never occurred to me. Yeah. Never occurred to me.
So anything ever been is?
And yes, not trying to be funny. If you keep a fake land off every night, I'm like,
Oh my God.
Oh, I see.
Oh my God. I had a friend
I never thought about that.
that he had two prosthetic legs because he was in, you know, when he was younger, he was working at this plant, and whatever that machine was, 7 foot.
sure.
And you know, we're just friends, but he felt comfortable around me.
Mm-hmm.
He took them off.
And I'm only laughing because that just doesn't bother me. But I can imagine that would be something
And-
shocking. Look, as long as you got one good leg, it'd be fine.
Okay.
That's what they say.
Is there anything wrong with the third leg?
Oh my.
You still have one good leg, right? As long as we clean all that, then you're good.
And that's the one thing that we kind of talk about a lot is it seems as though the dating pool is diminished.
Yeah, but it is.
Like, why is that?
There are a lot of different reasons. Men are going to die 10 years younger, typically 5 to 10 years younger.
Really?
When it comes to the Black community, we've been losing men from the get-go, so the percentages are different. And maybe about 12% of Black men are married to non-Black women. I mean, so we think it's 50% and that kind of stuff. It's only about 12%, but that's the highest percentage of ethnic groups in terms of who is marrying outside the race. And then we still don't marry outside the race.
Right.
Ours, we could expand our horizons. We don't because of the historical.
But you know what?
oppression,
I'm in that area which I'm in. Look.
But how do you how we say that? But what's your type? What are you going to tolerate?
You got it.
I already told you I like them light.
Okay, that's a good point. So they can used to be white and still like. But would you date a white Southern man? Would you date a European man? Does he need to be blonde? Does he need to be dark hair? Does he need to have blue eyes? Does he need to not have those? Can he be a redhead? Can he be from the country? Can he sound like
Prince
he's not?
Harry read it. Yeah, I don't know. He would have to definitely be cute.
But what's cute? What's your so you know and right. Who's somebody who's a white man that you think is cute?
So Prince Harry, I think he's cute.
Oh my God.
Yes.
He need hair
He does
on his head.
He does need hair. Not his brother though. Not his brother. Is not my
Who needs hair too?
Leonardo DiCaprio to me is cute.
Oh.
Yeah. Kevin Costner. Kevin Costner.
Yeah, I.
What about
I'm trying to think.
the one that played Fast and Furious that passed away?
Dom.
That's the Rock.
That's
Paul.
Dom.
Paul.
That's
Dom.
not
Dom. Dom is the one. Dom is the built one.
What are you talking about? Van Diesel?
Yeah, Vin.
Right.
Is that Vin Diesel?
Yeah, Van Diesel.
The Rock?
Hair black.
Is that the Rock?
The Rock is Vin Diesel. You talking about?
Oh, Vin Diesel.
Vin Diesel's biracial.
Yeah.
Yeah, but I mean,
that figure.
I'm sitting here trying to figure out who is
The Rock.
okay. So I mean, because the reality is we all have our type,
Right.
and so
Yeah.
who would be your type? And so if you were dating a white guy, who's your type?
Even what's his face from Green Day, Adam Levine. He's cute. I don't like his personality.
Picture his
but-
face. I know I can't picture his face. I know.
Yeah, we won't be competing.
Yeah, for me, so Vin Diesel, there's mine. Vin Diesel, The Rock, along those lines for me.
Okay.
I like them buff. I don't like
Yeah.
thin, buff. Not so much you got to be muscular, but just just got some size on
So
it.
I
Okay.
picked up this guy who was Mr. Arizona.
Mr. Arizona,
Yeah, he's
what is he? Latino, Caucasian?
he's black.
Okay, but you mentioned biracial guys.
Yeah.
Who is your white guy, or that's the closest you would get? And don't worry, I'm trying to think.
Matter of fact, I could do. As a matter, I always said that I would never, because even on, well, they don't let you put it there, but I always say that I don't date outside of my race. It's not prejudice; it's preference.
That's
right?
fine.
I've
What about
always
John
said that.
Travolta?
No. No.
Not the young one, not the old one.
But now that
Yeah.
but now that we're having a discussion, I could definitely do that. I believe I will definitely consider biracial.
Okay, so that's the best. That's the most you could do.
That's the most I can do right now.
Oh, that's fine.
Because this is kind of new.
That's fine.
So because I didn't know Vin Diesel was biracial.
That's fine. What? That's fine.
I didn't know that. I don't
You
know. I
didn't
guess
get-
I just never thought
You didn't
about it.
realize he had flavor, or he had just enough flavor that you would be like,
Well, just watching him on Fast and the Furious. And some other movies too. So I like a man that has a deep voice.
sure,
Like Barry White.
yes,
Okay, let me tell you something. If you Barry White me,
yeah.
and I might just
You're gonna miss a lot of. You're gonna miss a lot of stuff from the boys.
I'm with you now. I will miss a lot of stuff. It may take you going, girl, did you look?
Did you see his face? Did you see his nose?
And this one, yeah,
Like,
I don't know.
noses.
I can show her. Tasha, look at this. I said, good, this might be the
No.
boo. This might be the boo. There's the nose. It's always, she holds in on the nose. But we all have our thing. Yeah. We all have our, yeah.
I'm trying to think of who I like the old baby.
I can't think of any other than Vin Diesel. That's the template from me.
I mean, I like dark hair, so I like dark brown hair. So I like an Eastern European type.
Oh,
dark
so
hair.
what about the one that
Mm.
plays that with the red suit on?
Red
Johnny Depp. Is it Johnny Depp?
Johnny Depp?
He plays Iron Man.
No, I'm like the Robert Downey Jr.
Yeah, him.
Mm-mm.
No.
No.
Oh, he's so
No.
cute.
Mm-mm. I don't like Robert Downey Jr. I struggle to kind of. Back in the day, Tom Selleck.
Tom Selleck, yeah.
Yeah.
I just don't like that mustache. Oof.
Oh, I love
Yeah.
facial hair. Oh, I
Yeah.
love facial hair. Now, we had a bushy 70s
That
mustache,
thing
but
was wishy.
and I don't like a big bushy beard and stuff
Yeah.
like that. But clean shave, a neat, low. Oh my God, I love me some facial hair.
Dan Marino.
Huh?
Dan Marino. Miami Dolphins.
He's a little too white man looking. I can't believe I'm saying this was authority. Oh my God. And it's so funny because I keep trying to think of athletes because
Oh yeah.
Mm-hmm. Oh yeah, he's an athlete.
I think Kevin
Now-
Love looks good.
Who's Kevin Love?
He's a basketball player. He's playing for Chicago. He played Cleveland. He used to play with LeBron like that.
The
I like
Larry Bird.
No. I like Kevin Love.
About Patrick Mahomes.
No. No level.
Yeah, little man.
Yeah, he a little. Number one, he's a little man. So
Yeah.
so
Cleveland. What's what Cleveland plays for Cleveland?
a white guy.
Oh, not Cleveland. He doesn't play for Cleveland. He's dating Megan Thee Stallion. Right, Rachel?
Oh,
He's cute.
I don't think he's cute.
Clay
Clay Thompson.
Thompson.
I don't think he's cute.
Clay Thompson.
And Clay Thompson biracial. So I mean, so I'm trying to think of a pure white man in terms of type, and
Mm-hmm.
I like them with black or dark brown hair, dark brown hair or black hair. I don't like light hair necessarily. I don't like blondes. I don't like redheads.
Yeah, like-
Still got to be linebacker type,
Okay.
big juicy guy.
Travis Kelce.
Travis was trying to look black, even though he's not cute like I would like him to
Yeah.
be.
Yeah.
But he had that look and that
Right.
aura,
Right.
Mhm.
and so that would have gotten some play. I'm really because when it comes to me, it's gonna be like, oh yeah, him.
Mufasa.
Yeah. Oh, yeah.
Mufasa. Yeah.
Yeah. Hair is too big.
Yeah. Oh, Mufasa. I can overcome the ears.
That's too.
She said, "All right."
I just can't bring somebody up. This,
See, I can't either.
that's
That's
an
look.
actor or whatnot right now.
Mm-hmm.
I
mean, they're just they're oldies.
Because I like a man that has sharp, harder lines.
Oh,
Chisel, more chiseled,
Yeah.
very manly looking. I don't typically find Asian men attractive because I think that they are too girly looking. And I don't mean it, and I don't mean that to be racist or hateful or anything.
Someone. Oh my
But
goodness.
like you see the folks coming out of Korea, and you almost can't tell. It's too androgynous. It's too androgynous.
Yeah.
Okay, I think that's a better way of saying it. It's too androgynous. I like a very clearly, distinctly masculine look. Yes.
Okay.
Okay. And so
There's
I
no
want
question
one
there.
a rounder face. I like chiseled details, harder features.
Yeah.
And so I think that some of the men that I find attractive are not 100% attractive to everybody. They could be a little bit too hard looking, but that is attractive to me in a sense.
Did you see the movie Sinners?
Yes.
What was his name? With the bald head. He reminds you of he was with Michael B.
Del Orlando. Yeah, I like that's a very good example. Shannon Sharp is another good example. Shannon Sharp's a very masculine looking man.
Yeah.
Okay.
Yeah.
So let me be
He got
clear.
that nose though.
Yeah. I had a thing for Shannon Sharp for a long time. Until I found out how stupid he was.
Yes.
Okay. That's the only reason. But if the man of my dreams came in that package, that is my dream package.
Mhm.
I like them tall, black, and fine. Tall, big, black, and fine. I like that.
I mean, yes.
See that?
Okay, I take. Look, I believe in matchmaking. Yeah, you put me in front of somebody because I'm terrible at meeting men. I'm terrible at dating. Just put me in front of somebody because I definitely open
Just
and
got a notification. Let's see.
They have this
About
thing
what?
called Kendra Singles.
Be okay.
Heard that?
Oh,
Kendra Singles.
mm-mm. I am not an online dater.
And then you get a
I need an AI. I need an avatar to be on these dating profiles.
then you get a notification thinking like, could this be the one? And that's what you get.
But see, that way he wouldn't turn me off. He might be MS-13, but he would turn me off.
No.
Why are you squeezing his face?
That's the other reason I can't be on the dating site. Oh my God.
They don't know how to take pictures.
Goodbye. Okay.
That's a nice picture.
Yeah, that is a nice picture. I swipe. Then don't swipe it.
I'm sorry.
Oh no, don't swipe.
I'm sorry. I'm letting in my phone. I don't need to swipe it.
Oh no, we're back. Go back.
Oh, I messed you up. That's right. That's right. See, that's sabotage.
I gotta pay. Look, I gotta pay to go back.
I'm so sorry. I'm so
Sorry.
okay. I remember his
Go
name
back.
and his name. Don't worry.
Remember
Yeah, I remember the name and age for you.
Let's see. That's the new one. Oh,
And so, what do
Same,
you
man.
think about dating younger?
cute.
I'm fine with that.
Yeah, me too.
How much younger?
Okay.
4 or 5.
Huh?
But for me, 4 or 5
Oh,
4 or 5.
years.
4 or 5 what?
Years. Yeah.
That ain't even younger. The older we get, that ain't even younger. No, 15 years.
Woo!
15 years?
Yeah.
15 years. 15 years? Whoop, child. Ooh.
He said he's not
Ooh.
moving into
40.
Kindergarten when you were in high school.
He could have not been born almost when I was in high school.
See,
I'm
you
not
gotta
sure.
share and
I wouldn't, because I wouldn't want any man younger than about 40 at this point.
right.
For 2 reasons. One, I don't want no silliness.
Yeah.
And number 2, you kind of already should know at this point if you wanted to. You've either had your children and you're done,
Right.
okay,
Mhm.
and your erectile dysfunction hadn't really kicked in,
Mhm.
That part.
you know?
Mhm.
And so I could not see myself doing younger than 35. I definitely can't see myself doing
35.
that. But I don't seek that.
So I don't want
But
anybody that's
40s.
younger than my kid.
I could care less. But understand, I had a child when I was 40, so he's 19. There's no risk.
Wow. Okay.
There's no risk of that for him. But if I had a child that was 35 or 40 now, too bad. Don't bring your friends around me.
I know.
I'm all fair and love war.
Okay.
Yes.
I think my highlight is just, mature, very mature, with substance,
Mhm. Oh,
sound.
how much older than you?
See, I don't want to go older than 65.
Okay.
I want to say between 60.
I can say 61 or 62.
Y'all
Between
wouldn't do 70?
60 and 65.
At this age, y'all wouldn't do 70?
No. Ooh.
If I were to do 70,
Unless he was Denzel.
he would have to be.
Look, Denzel get to a point where I wouldn't do Denzel.
Yeah.
Oh, what?
That's
Right.
all that drinking.
He would have to be. He would have to be a type of fit.
Sure.
Okay, a type of fit. For me to do 70, he would have.
Ooh.
He would have to be it, and he would have to rank it
Well,
70.
for me to consider 70.
that's only 10 years older. But, for me, that's only 10 years. But,
Yeah.
I mean,
Yeah, so
you and I are the
10
same
years.
age.
Yeah,
So that's 10 years.
10 years. Yeah.
But then you wouldn't do 50 either. You wouldn't do 45, 50. Yeah, so that's all right. So that's
It's
consistent.
too young.
So you basically going to your same age range.
So I would want them. So I would do 53.
Mm-hmm.
53, 50, maybe 52.
Because you were 58, right? Or you 59.
I know
You don't be telling me my age.
You're gonna edit.
I'm
You gonna edit it anyway.
Look, Rodney Gary told me I'm
Right.
22.
Who's that?
Rodney Gary.
All right now.
You look 22.
There you go.
I don't care about
Tell
the
me
age.
more. Tell me more.
Okay. Okay. I don't care about the age.
I would probably 52. I couldn't do 50.
That's hysterical.
No.
That's too funny.
No. Because I think they still have, well, if they were emotionally mature, because there's some of them that are just not mature. Like, what in the world is going on with you?
Yeah.
I know.
I don't know.
I know.
Yeah, but if they're not there by 40, they're never going to be there. So that's on,
Okay.
So all the same rules apply. They don't get a pass on any of the other rules.
Absolutely.
But no, I would not want to be 60 running around with 20 something. I say that, but
Hey.
if we just kicking it, it's all good.
But but there are some younger men that like older women.
Yeah,
Right.
but
Because these men been here. I mean,
I was
they've
in
been
New
as young
Orleans
as like
34.
32. Like
I don't know.
32.
my biggest issue would be the notion of infidelity. That's
Right.
my bigger issue.
Right.
Um,
Yeah, because they see something younger or their age range is
or they just out there hounding anybody,
Right,
and
right.
whatever.
Yeah.
So so we'll see. But it also is, where are you going in life? What are you doing? And at 40, you should be well on your way to that. Even having recovered from whatever didn't go right in your 20s and 30s.
Yeah.
You see what I'm saying? So that's why I think that probably 40 is a good cutoff. But I mean, I know that's a 20-year difference, but I'm bothered.
I'm still
Hey, I ain't mad.
part 2.
Or two. Or heterosexual.
Better catch Stella's groove.
I know that's right. So as we end, I always want to end with something positive, something that we can give our women.
Mhm.
Sometimes it's one word, or sometimes it's just some type of a nugget, some type of nugget. So who wants this one?
My bottom line. I have my bottom line. Menopause is not the beginning of old age. It's the beginning of our best age. So, and I'll get into that. But that's. But I love this stage in life. Yeah, who knew? I love this stage in life.
Yeah.
Oh yeah.
I guess I would say, don't lose yourself.
Don't lose yourself.
Yeah. Don't lose yourself. Never stop being authentically you.
Yes.
Right.
Yeah. Don't allow life or relationships to dumb you down.
Right.
Don't compromise yourself away.
Right.
So that you do that a lot.
Oh yeah.
You hear so much about people. It's like I live the first blah 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 years for my kids or for my. You hear so much of that now, and it's like, and now I'm going to live. You shouldn't do that,
Right.
Because
nothing is promised. Nothing is
Yeah.
promised.
So,
I love
as they can say, live your best life now.
Right. Absolutely.
All the time. Yeah. Absolutely. Absolutely. Fabulous.
So if I had to leave our listeners with something, it would be I guess stay true to who you are. Relationships come and go. But as long as you are comfortable in the skin that you are in, comfortable who God has called you to be, be you.
I love that.
All right. We will see you next time.
Okay.
Oh my goodness.
That is too funny. That was fabulous. That was
good.
It's her voice and her perspectives on perspectives. 26 to